Hi everybody, this is Heather Wallace from Bridle and Bone Wellness based in Monmouth County, New Jersey. We're here with our friend and colleague today, Dr. Kendra Pope, who recently went rogue and started her own independent veterinary practice. So we're going to talk to Kendra today and learn a little bit about what she does and how she can help your pets. So Kendra, tell us the name of your business.
Yeah, so it's actually just my name, Dr. Kendra Pope, and I did that to just kind of, when we got started, we wanted a simple way for people to find me. The business is about wellness and all different kinds of things, so it's evolving. So right now, just Dr. Kendra Pope.
So you can find her at Dr. Kendra Pope on all social media channels, Twitter, Instagram, Facebook are the big ones, right? And she's got a website coming soon, so make sure to keep checking back for that. And we'll also link to her from our website. Tell us a little bit about your background. Your background is in veterinary oncology. And so tell us a little bit about how you got started in that and why.
Sure. So it's interesting because, and we've talked about this before, I think a lot of people, when they are following their passion and they're doing more than a job, they're pursuing their career, it often finds them. And so it's not always something that you necessarily know exactly where you'll be. You just look back, 10, 20 years later and you say, oh, that's why that all worked out. So I always knew I was going to be a veterinarian. From the time I was a little girl, there was never anything else I was going to be. And the oncology piece came later after a few experiences in my own life. And I knew that it was where I needed to make a difference. The holistic aspect came along while I was in veterinary school. I got exposure here and there, and I realized how perfect it was for the cancer patients. And so through a lot of education, a lot of training, a lot of time studying, I'm now able to do all of the conventional and the holistic together.
Which I love. I love that integrating the different therapies, treating the entire body, learning out why something is happening, trying to but address that. And so tell us a little bit about what you provide in your practice. I know you do acupuncture, nutrition. Tell us a little bit about everything that you do.
Yeah, so the big things are acupuncture, herbal medicine, integrative nutrition, which means I work alongside a veterinary nutritionist. We have energy workers, massage therapists we work with, and anybody else really that we need to provide those modalities that were originally thought of as complementary and alternative. We pair those alongside high-level conventional medicine, so whether that's myself practicing it as an oncologist, whether that's an internist or another general practitioner that's in on the team, I serve as another teammate so that we can really give the highest level of all of the tools that are in the toolbox.
Which I love, and that's why I think we love working with you, because you're so open to thinking outside the box, and I think that's a great thing about veterinary medicine and how it's turning today. I feel more and more people are looking for natural ways, and not even natural ways, but just any way to help their animals better, naturally, holistically, in an integrative way. So now what I love is the fact that as a veterinarian, you're willing to work with us who are not veterinarians, because we do have a different perspective. And so what do you like about working with people who are maybe not veterinarians?
Oh yeah, that's a great question. So I think that it's interesting because it's, I think that it's whoever and whatever is best for the patient. And that's the approach that I take to all of my patients and why I do what I do with the other modalities, because as long as we know that it's safe, that it's not going to be doing any harm, we know that there's a possible benefit, and it's done in a safe and appropriate way, I want to work with the people who are the best. Whether they're doctors, whether they're not doctors, it doesn't matter who they are. And I really enjoy working with a lot of different people because I think that it helps to stretch your communication skills, it stretches your knowledge, it stretches your ability to really be the best version of yourself, whether that's personally, professionally, however. And so I just like collaborating in general, which is what we're saying without saying that word, because it allows the best opportunities for all the patients.
Sure. do you see that modern veterinary medicine as a whole maybe moving this way, or do you think you're kind of like on an island of your own?
It's interesting because I think that the veterinary community, and I've obviously had these conversations with colleagues, the veterinary community understands that the owners, the pet owners themselves are seeking out these modalities for them. And so therefore they're going to want them for their animals. And it's here. I think that there's still a lot of skepticism because we as professionals, especially high-level trained specialists, want to know that any doctors that are part of the team are also doing their due diligence to practice high-level medicine. And as of right now, there's no governing board for the holistic doctors.
Okay.
And so that's something that's in the works right now. So I think within the next few years, as that is something that the conventional doctors are more comfortable with, then it will be generally more comfortable for everyone. The human side of things is already there. There's naturopathic doctors, there's allopathic doctors, there's osteopathic doctors, and so we obviously will be heading that direction at some point just by the nature of society and community and what people are looking for. So I think that it's inevitable, it's happening, it's just a matter of how it's going to be accepted and done the right way. And so part of the reason that what I am really passionate about doing as a specialist that's involved in these what were previously thought of as alternative modalities is to do research, to provide evidence, to give the confidence in those modalities that my conventional colleagues are looking for so that it is as accepted as anything else.
So that's perfect. So that leads us to, because we talked about doing a clinical trial, about, acupuncture and massage with cancer patients and things like that. So, I think going forward, doing something like that, just proving to everybody the benefits, and
the safety, because there's still a lot of concern that it's not safe.
So it's really interesting. I think like we're on the cusp of something that could be really great, and it's all a matter of doing it the right way, providing that background, that education, and just keeping the lines of communication open, closing down. So as we talk about this, we're going to end up doing hopefully a monthly series where we talk with Dr. Pope here about different topics that come up in the veterinary world that impact your animals. And so stay tuned. Follow her on social media, get to know her, make an appointment with us, make an appointment with her. She's located in Red Bank, New Jersey, and we are going to be working out of her office a couple days a week. So we can see clients in tandem, back to back. Do give her a call, check her out, find us. You can always find her information too on our website at www.bridleandbone.com. And stay tuned. Make sure to subscribe to the channel and stay tuned for our updates. It's going to be fantastic.
See you guys soon.
Thanks for following.
Bye.